Hi everybody, my name is Nabiha Sayed and I am in Dr. Pearson's crisis intervention class. So today for my crisis intervention presentation, I am talking about intimate partner violence. So today we'll be defining what it looks like and learning how we can intervene as crisis workers. So a couple learning objectives for today. We're going to understand the gravity and scope of intimate partner violence, which I will be referring to as IPV for short. We're going to understand the factors and stressors that can lead to IPV. We're going to identify the cycle of IPV. We're going to learn about the intervention strategies for IPV as well as the assessment strategies for IPV. Now, I do have my notes over to the right, so if you see me looking back and forth, that's why. The program I'm using, I'm not able to have my notes and the PowerPoint pulled up on the same screen, so that's why I'm looking back and forth a bit. So a couple important terms to know because these are often used interchangeably. So battering indicates any form of physical violence perpetrated by one person on another and typically includes a life-threatening history of injuries and psychosocial problems that entrap a person in a relationship. Okay, now while abuse is a general term that indicates that physical violence is only one weapon in an armory of coercive weapons. So, obviously this can also include verbal abuse as well. Assaultive behavior includes not only harmful acts against a person, but also both verbal and behavioral threats to significant others, pets, or property. And domestic violence is any act of assault by a social partner or relative, regardless of marital status. So, a lot of times we think of people in a romantic relationship, but that is not always the case. This could be from a father or a brother or really anybody who lives in the home. So a couple statistics on IPV that I found pretty alarming. About 1.5 million women and 830,000 men were victims of intimate violence in the United States. 25 to 44% of women and about 7.6 to 13.8% of men in the United States have experienced a violent incident with a partner during their adult lifetime. And a reason for this very broad range in reporting is because a lot of times, IPV does go unreported. People are scared to report what is happening in their home, or even when it is reported to maybe a medical setting, those statistics are not maybe readily available, or maybe even the medical practitioner fails to report what has happened to the patient coming in. Okay, so a couple of theories behind IPV, because it is really important to find out why is IPV so incredibly prevalent. So attachment/traumatic bonding theory. So this basically means that the batterer, I'm going to say batterer and victim to keep it a bit more simple. So the batterer may have seen this kind of violent behavior in their childhood. Maybe they saw their father being violent towards their mother, and they simply see it as the only way relationships work, or they use violence as the primary method to get what they want. Coercive control. Coercive control is, it's coined by Morgan 1982. So this is like an intimate terrorism, and it's whereby violence or the threat of violence is used to break the victim's resistance and bend her to the will of the terrorist or the batterer. This is the only way they see having a relationship that works for them. They can only use violence and this brainwashing and terrorism to make their relationship work, and they see no other way of it working. Next is cultural reinforcement. So, as a nation in the United States, we promote and glorify the controlled use of aggression for protection, law and order, self-defense, and national interest. We still have the death penalty because we see it as a way to enforce a certain type of behavior. So this sort of kind of aggressive stance that we have as a nation, obviously it's going to find itself into the household. So people think that, how they get the way they want, by being physical about it or by being verbally abusive about it. Exchange theory. Exchange theory is when social services have maybe failed, or that the batterer doesn't see them as enough of a threat to not continue the assault that is happening at home. So they think that the benefits outweigh the cost. They think that, okay, I can continue to do this violent behavior and really nothing's going to happen, so I'm going to continue to do it. Feminist theory. This is when, women believe that until their status is completely equal to men in the greater context of the world, they're always going to be deemed less in the household And this is often why, violence will occur in the household. So intra-individual theory. There's evidence that psychopathology and neurophysiological disorders may play a greater part in IPV. So, this could be personality disorders or ADD or psychosis or internal head trauma or substance abuse, of course. And these can be contributing factors or exacerbating factors of IPV. Learned helplessness or battered woman syndrome. A woman might have seen this kind of behavior modeled in what maybe her father did to her mother, whether he hit her or verbally abused her. She might have normalized this behavior, and so she's kind of has this learned helplessness inside of her. It could also mean that that the woman has chosen behavioral responses that have the highest predictability of causing them the least harm in the known situation. So they have kind of accepted that harm will and can happen in the household, but that they take little action within the household, little steps of action to kind of minimize the amount of damage. So if she knows that, okay, he doesn't like when I leave things on the floor, when the children leave things on the floor, he doesn't like when he comes home and there's no food ready, she might try and address these problems so that she can prevent or delay the abuse that she knows can happen. And finally is psychological entrapment. And this is when, the woman doesn't have she doesn't have the will to leave the relationship because she feels like she has invested too much time and too much attention and energy into the relationship, and there's too much shame and embarrassment when it comes to leaving the relationship, so she might just end up staying. All right, now let's talk about some exacerbating factors and stressors in IPV as well. So there's quite a lot of them, so we're going to go through them a little bit quickly. I know I've been talking fast, so I hope you guys are keeping up with me. Okay, by the way, I know this is a very serious topic. I am naturally a smiley person. That does not mean I am happy talking about this. I just I have to kind of stop myself. It's a very, very serious topic, and as I was doing my research, it was quite upsetting. But so if I'm smiling, I apologize. Nothing about this is funny. It's just something I have to work on myself. So I'm very sorry about that. Okay, so geographic isolation. So a new couple might have moved to a place where they don't have a support system or they don't have friends. So the victim might not have any resources in her immediate area, and she's literally physically trapped. Social isolation. Again, she might not have resources or family to reach out to. So she is then trapped as well. She could literally be in a metropolitan area, but she doesn't feel like she can look to anybody else as a solution. Economic stress. The victim is economically dependent on the perpetrator. She knows that he is where she gets her food, her shelter, so maybe she doesn't want to cut those ties because she's scared of where she'll go. Medical problems. Again, these are also exacerbating issues. So what if one of either the victim or the perpetrator, either of them have chronic medical issues? This can exacerbate tension in the household. When people are sick, especially chronically sick, it is a very stressful situation. So this could just increase tension in general. Inadequate parenting skills. There's children involved, and maybe they didn't want these children, or maybe they don't know how to keep these, how to always keep control of their children or keep their children happy. Maybe the children, if favor one parent or another. All of these can create a more stressful household. Pregnancy is an incredibly stressful time, especially new parents. They don't know whether they can afford their new child. They don't know if they have the time or the energy for their new child. A pregnancy can be very tolling on the body as well. Maybe the perpetrator, or batterer, is used to a certain amount of attention from the woman, and because she is now going through this incredible journey with her body, she doesn't have the amount of time that she maybe once did to pay him attention. Maybe they didn't want this child to begin with, and that's increasing tension between them. Family dysfunction. This could be a number of things. This could be maybe the victim doesn't like the in-laws of the batterer's parents. Maybe the batterer doesn't like the victim's parents. Maybe they're stepchildren in the house. Maybe they have a child that acts out a lot. This could really be anything. Any amount of family dysfunction can increase tension, even if their relationship was fine. Let's say, the mother and father, they have their relationship is okay, but if they're having stress from any other part of the family, it could put a strain on their relationship and increase the likelihood for IPV. Alcohol and drug abuse, this is fairly this is quite understandable that alcohol and drug abuse, just the symptoms from these two issues can cause a lot of problems in the household. There might be anxiety about like whether or not they can get their next fix. This could also cause a financial strain because they need maybe money that the rest of the family needs to make sure that they get their fix. So again, this can cause a plethora of issues. Educational and or vocational disparity. A lot of times if the woman is a higher achieving, or if she has a higher paying job, or if she has completed more educational than the man, he might not feel adequate enough for her, and this can definitely create a really bad this can cause a bad relationship between them. This can cause him to feel inferior, and he might address that by attacking her. Age. So it is actually found that younger men are far more likely to engage in IPV. So men in their 20s. So that can also be a factor. If maybe a couple gets married very young, their likelihood for IPV is greater. Disenfranchisement. It could be that social services or resources, the police or shelters, are not a viable option for the couple because maybe they feel that they are treated unequally in the world. So for example, if maybe they come from an ethnic minority, they believe that they are treated differently by maybe they're treated differently by a lot of these social services, so they are less likely to take advantage of them. They might not want to pursue, marriage counseling, or they might not want to, take advantage of resources because they don't think they'll be treated fairly. Rejection. A lot of times when a man is rejected, he, doesn't take it very well at all. He feels like it's, again, kind of leading into next one, a threat to his masculinity, threat to who he is as a person, and he might want to retaliate by causing violence in the household. All right, now we're going to talk about the cycle of violence. So we can kind of start it here on the left with tranquility prevails. Maybe there's been no violence in the relationship so far. Maybe there has been some violence, but we're now going through a stretch of time where there is tranquility. Maybe the man, he feels very guilty about the violence that has occurred, so there is now a stretch of peace in the household. But then, of course, inevitably, tension starts to build, and this could be anything. This could be maybe a stressful day at work. This could be, a messy household, or kids out of control, or could be feeling physically sick and then taking it out on other people in the household. So again, this tension slowly starts to build, and then finally the violent episode occurs. And this is when all communication has failed, and they have resorted to violence, either verbal violence, verbal threats, or it could be, physical violence. So again, this is when all communication has failed and it has succumbed to violence in the household. And then the relationship takes on crisis proportions. So there's a couple things that can happen here. The victim might reach out to services. They might reach out to a crisis hotline. They might reach out to a shelter or a friend, or maybe the batterer apologizes profusely and they are able to work things out. But again, it is a cycle, so it could very, very well repeat. Maybe they have negotiated, or a time of tranquility occurs again. So that's kind of the cycle of violence here. Now, this is kind of the age-old question. Why would someone stay in an abusive relationship? If the relationship is causing someone so much damage and so much peril in their own household, why would they stay? And that's very easy this is a very kind of it's very black and white for people who have never been in an abusive relationship, but anyone who's in an abusive relationship can tell you that it is way, way, way more complicated than that. So let's go over a couple of the reasons why they might stay. So fear of reprisal. They might think that the batterer might come back for them again, that if they leave and that if they report this, that the violence will just become 10 times worse and that they'll find them. Next, shame. They believe that they'll be looked down on from people in their community. If people find out that that was the relationship they have, they might be embarrassed by their friends or their family. Maybe they have hope of salvaging their relationship. They remember what their relationship once was, that it was a time when they were happy and tranquil, and they want to go back to that time. Financial concerns. They might not be able to leave the relationship because that relationship gives them food and clothing and shelter. And leaving it, it's not a sure thing where the money will come from then, especially if she doesn't have a job or a stable source of income. Lack of resources to turn to. Again, this can come from geographic isolation or social isolation, but there's just no resources that you can tangibly hold on to. You might not have dependable resources around you, so you're scared of kind of leaving this relationship and kind of closing that door and now looking to a resource that you know nothing about. So that is a very, very scary step. There are children involved. Maybe the children love their father, the father loves their children, and they're very scared of detaching that very strong root. All right, so now let's actually talk about when the crisis worker comes in. So let's talk about some assessments. So let's see here. Bear with me. I'm just going to pull my notes. Okay. So let's talk about assessments here. So first we're going to talk about personality measures. So we're going to look at, the crisis worker might look at like if there's certain attributes or traits or psychological profiles that the victim might have that kind of indicates that they're like potential victims to abuse. So maybe they've witnessed being a victim of personal violence as a child. That seems to be a consistent characteristic. Or we look at the Spence and Heimrich attitude towards women scale. So this basically measures the traditionality of a woman's attitude about her role, as well as her perception of significant others' views of women. There's also the Battered Women Scale by Schwartz and Matley. And overall, battered women present many of the symptoms of post-traumatic stress disorder and can be placed for diagnostic purposes within the PTSD category of the DSM-5. So we'll look out for those PTSD traits. Next is a clinical interview, and this is incredibly helpful. I found, of course, I'm not a crisis worker, but just reading about it, I found it a very helpful method to kind of gauge where the victim is at. So, what the crisis worker will do is take a history, and it should include questions about any violence in the household. So it'll be like hitting, threats, controlling, destruction of property or pets, forced sex, alcohol and drug abuse, and the partner's hypervigilance and paranoia about the client's actions. So like, how do they feel about you being here right now? What will they do? What are they like? Questions like that. Like, what did the abuse look like? When was the last time you were abused? How frequently is the abuse happening? These are all really, really important questions that the clinical interviewer should ask. And, when a woman comes or calls in to report a battering, you need to believe her immediately and start that intervention. Make her feel validated and heard. And that is the most most crucial part of the clinical interview. Of course, you need to do some triage assessment, especially if the battering is very serious. Look at her medical safety, at the safety of her children or anybody else that's in the household, any pets that are in the household. And it's extremely important to be also aware of any masking symptoms someone may have. So a lot of times when a battered woman comes in, she may be displaying symptoms that we might mistake for depression or anxiety, but they're actually just symptoms of domestic abuse. So unless we ask them if they're being battered, we don't know. So it's very, very important to ask someone if they're being battered, if they are suffering abuse at home. Even if the presenting problems have little to do with battering, it's always good to ask in a compassionate way and make them very comfortable so that they are able to self-disclose to you what's happening. So you have to make her feel validated. You have to also emphasize that being battered is absolutely unacceptable and that you have to commend her for coming in and being brave enough to tell you about what is happening. But again, going back, it is really important to communicate that battering is absolutely unacceptable, because it might be so normalized in her head and in her household that it'll take an external source like the crisis worker to tell her that that is not normal and that she does not deserve it. So let's talk about medical settings. I'm going to talk about it very briefly because we will be going over it in our case study as well. But a lot of times a woman who's battered might come in for some abuse that she suffered at home, but she doesn't want to make it clear that it was because of the abuse. So it's very important that if we recognize signs or symptoms of abuse, that we take action, that we ask in a kind, not in confrontational or antagonistic way. We ask them direct questions about what's happening at home, and we ask them gently. And I'm going to go into exactly how we will do that in our case study. All right, and then there's crisis lines. So in this case, the worker's job is to try and help the woman cope with the immediate situation. What is happening right now, and how can I help you? And it's important that we then get an idea of like what's happening in the household as of right now. We have to do a triage assessment and make them feel heard. And again, we cannot tell them what to do. We cannot tell them to leave. It's important that we first assess what is happening and what is best for them. So we need to ask them a series of questions like, can you leave? Do you have resources? What is it like at home? Do you have a safe place? And once you make sure that all the pertinent information is gathered, then we can look at any available action or any appropriate action. Okay, sorry, just checking my time here. Okay, methods of intervention. So I'm going to try and make this under 30 minutes. So let's see if I can do it. So listening. So the victim must know that the crisis worker understands and accepts her present situation in a way that's non-judgmental and non-value laden. They have come to you after going through something so terrible in their household. So you need to make sure that you're not also being antagonistic towards them. You need to make sure that they are heard and that you understand what is happening to them. The crisis worker must also immediately reflect that they understand the difficulty and urgency of the situation by positively reinforcing the battered woman for calling and taking a step towards resolving her problem. So we did talk about that before, but that is probably one of the most important things that we can do. Supporting. So the caller is given both explicit, implicit permission to ventilate. So we have to let this person free flow all of their anger, their hurt, their fear, their guilt, and other debilitating feelings that they might have. They don't have any other outlet, so it's important, or they may not have any other outlet. So it's important that we make ourselves available to them. A sense of lack of social support is one of the major factors for battered women. So it's so important that we communicate our support for them. And again, this may be pertinent for people who come from a different ethnic background, or if they come from, they have a different immigrant status. They might be scared to approach in any help from institutions because they don't think they'll be understood. So again, it's important. I'm not going to talk about it too much today, but having a multicultural perspective and understanding the diverse areas they may come from. The crisis worker in this case, they might have to exert an excruciating amount of patience, just sitting there and listening and being ready to accept whatever they're going to be talking to you about, and making sure that they are able to communicate with you on their time and open up to you on their time. You can't move the victim any faster than they're willing to move. And at some point, like the victim might try and blame you or blame the system. A lot of misplaced blame might be happening. So it is incredibly important the crisis worker stays calm and just continues to support the victim. Facilitating. Okay, so this is when we try and get some action going. You might have to, deal with the victim's feelings of dependency, ambivalence, depression. This can all be signs of the client's immobility, why they're not able to, get out of their situation. So we have to use open-ended questions and try and understand like what's happening in their home. We have to restate what they've already told us so we can make sure that we're getting clear and accurate information. And we have to also reflect on what they've been telling us. So a couple really quick things that we can do for facilitating. One is be real. Don't hide behind, just being a crisis worker, and don't present yourself so bureaucratically. Next is set limits. Um, of course, if you yourself are not in a good place, then you won't be able to be open with the victim who's in such a vulnerable place. So you have to make sure that you yourself are in a good place. You have to give the victim time and space to freak out, to let out their emotions. They just might have come from an episode or a very traumatic event, and you just need to let them vent, freak out. Maybe they'll say some things, maybe they'll be cursing, and you have to let them do that so you can help them. You have to allow the victim to go through the pain, but stay with them. Don't just immediately think you can start helping them. Don't immediately start coming up with solutions. Allow them to exercise all of the pain that they are going through, but stay with them. Remind them that you are with them and you are listening to them. Maintain eye and ear contact. So obviously over the phone, this means active listening, nodding, saying, yes, I understand, keep going, I'm here. If you're in person, maintain eye contact, don't look around, because this person is very, very vulnerable right now. Make sure that they are feeling heard and validated. And then obviously you have to be respectful and non-judgmental of what they're going through. You have to make sure that you are not reflecting your own biases on this person, and that your idea of what a heterosexual normative relationship, if you're in a heterosexual normative relationship, you don't want to be pushing those biases onto their relationship. So be very open-minded. Restate and reflect the victim's thoughts and feelings. It can be very, very hard to do this, but it's important for us to do this so that we ourselves can understand exactly what the victim is feeling like, and also so that the victim feels heard and understood, and also it can help them work through what they're feeling. Set priorities together. You have to set goals with the victim. They have to be on the same page as you so that they know exactly what the next steps are. Also, they can give you ideas that maybe you haven't thought of. You have to do what they're comfortable with and what they're willing to do. So come up with solutions together. You have to look at options, brainstorming with the victim. Stay away from whys. Like, why do you think or like, why did you stay in the relationship? Or kind of maybe don't accidentally like try to move any blame onto them, because they're blameless in this situation. Don't make the victim feel judged, or don't ask them questions that's going to trigger them and maybe put up defensive walls. And get the victim to experience catharsis, but do not let them get stuck in self-pity. So I'm going to read this from the book because I thought it was really important. The client needs to accomplish movement, and the crisis worker needs to move gently from nurturing emotional release to helping the client start to make plans, however small, concerning her own predicament. So again, it's really important to not just make them stuck in that cycle of self-pity, to make them maybe reflect and understand and move on and take action. Okay, and peer supervision and feedback are really essential for abuse workers. So, the intensity of what you're hearing is unlike any other. So you have to make sure that you're remaining objective. So it's great if you can get some cross supervision, or if you can get, the input of your trusted coworkers as well. Oh, that wasn't done. I wasn't done with that. Okay, ensuring safety. So, of course, the first thing, one of the things when you intervene is you have to see how critical the situation is. So, obviously, if she is physically battered, medical attention, you have to see like just how much, how if there's any physical damage, if she's having, a freak out, you have to deem what's appropriate in that situation. If she needs psychiatric help, and that kind of thing. You have to make sure that you are addressing her immediate emergency needs. And, the whole focus of your conversation with her is going to be how she's going to get through that day. So it might be really hard when you first start talking to this person. They might have so many issues and you might feel overwhelmed as a crisis worker. But what can you do to make sure that that victim can get through that day? What can you do to immediately help them? Okay, and another thing we need to do a careful examination of the woman's fears about the issues that she's facing, what priorities need to be set on them. You have to understand what her priorities are. What does she have? Children? Does she have pets? Does she have medications that she needs to attend to? And then we'll finally go over the options she has in dealing with them. And There is a big list of all of, what we can go through for ensuring the safety, but it is quite a lot. So I'm going to gloss over them. But the book does a great job, and I highly recommend looking at the Massachusetts Coalition of Battered Women service groups. It has incredible resources of what we can what we can do in these and what we can do in the first steps of intervention. Okay, and finally, advocacy. I'm gonna keep this one short and sweet. Basically, just make sure that the woman you're talking to, she has knowledge of like the alternatives that are open to her, like what is available in the legal and welfare system that she can take advantage of. They might be overwhelmed by the bureaucratic obstacles that they are facing. So help them work through that. This obviously means that the crisis worker has to have a very good working knowledge of the legal and welfare system so that they can help the victim, unravel all of that. Okay, this case study. Okay, a 25-year-old woman comes into a medical clinic and presents several bruises on her upper arm. She looks disheveled and keeps darting her eyes around nervously. Upon further examination, her wrist is broken. The doctor tells her she may have to stay in the hospital for a couple of hours, and she starts yelling, saying that she has to be home in an hour. At this time, the doctor calls you, the crisis worker. How will you proceed? Okay, so I want you guys to just take a look at that and, maybe pause this video that you're seeing and go over exactly like what you would do in this particular situation. So just go ahead and pause the video and then we will go over it. Okay, so again, this person clearly does not want to be asked about what has happened to them. It is pretty clear that they are going through, that they have signs of IPV in the household, given the fact that they do have bruises on the upper arm, which is an area that a lot of people will grab. Their wrist is broken. That could be from, any number of injuries. Maybe their hand has been flung in a way, in an aggressive way, and clearly they don't want to talk about it, and they're also on a time crunch to get home. And these are all signs that, from what we've kind of seen so far, can be very indicative of IPV in the household. So at this time, the doctor has called you in. What will you do? So I think the first thing that's really important is that whenever we sorry, my phone is not silenced, which is so unprofessional. Whenever we see signs of physical abuse, it is important that we don't become visibly alarmed and start freaking out, because that will disturb the person who has come in. That will disturb them further. So in a calm, rational way, we have to ask questions that we tell them is a routine part of any medical examination. So ask any specific and direct questions. Be like, you can ask how they got any of these bruises, and if they're not receiving that well, you can tell them that, hey, lots of times people get into arguments. Lots of times people don't know how to express stress that they're going through. Is that something that's happened to you? Like, I'm wondering if I'm reading from the book has a really great example about a similar situation. You can ask, like, I'm wondering if any of your bruises occurred in that way. When your husband or boyfriend, when you argue with them, does it get violent? Does it escalate? Do you feel afraid at home? Do you have any children? Asking questions in that gentle, non-confrontational manner can really help. And it's really great if you can also ask yes or no questions in this instance, because clearly this person does not want to talk. So if you can ask, like, like, do they get angry? Do you feel afraid? Did they do this to you? I think that asking questions like that can also be very, very helpful. And it's important by, raising the issue of arguing and saying things like, a lot of time, we all argue, we all get upset. And by normalizing the whole issue of arguing and confrontation, or maybe not confrontation, but the issue of like tension in the home, then that can make them a bit more likely to, speak up. Okay, and that can also, of course, make them more comfortable. All right. And now these are just a couple pieces of helpful literature. I'm basically out of time here, but I wanted to just point out a couple of these articles that were really helpful to me. So these are the six peer-reviewed articles. So this first one is about particular like considerations that we need to make with immigrant and refugee survivors of IPV. So a couple, more like uh, considerations that we need to make in a cultural context. And this is the second one is really, really interesting. It's basically about like any motivational strategies in interventions, motivational strategies in interventions for intimate partner violence, a systematic review of meta-analysis of randomized controlled trials. And then we have violence against immigrant women, the roles of culture, context, and legal immigrant status on intimate partner violence. This gives us a better idea of what this looks like in a cultural context. Kind of builds on the first one a little bit. And then a social inequities lens on intimate partner violence, reproductive justice, and infant mental health. The whole topic of IPV is so incredibly complex. There are so many social justice issues and so many social inequalities that can exacerbate IPV in the household. So this was a really interesting article. And then improving coordinated responses for victims of intimate partner violence, law enforcement compliance with mandated intimate partner violence documentation. So this is really interesting, more to learn about like the law enforcement side of it. And then this last one is really cool. I'm not a social worker, an informative service model for working with patrons in crisis. So even if you're not a social worker, like what can you do? How can you help? And a couple tips and more information about working with victims of IPV. And then I did want to include a resource and a shelter to help those victims of IPV. So this is a place called the Family Place, which is located in Dallas, Texas. This is the address, their crisis line, their main line, and their services offered. They have an incredible amount of services. I was pretty amazed by that. But they have, most importantly, they have an emergency shelter, but they also have clinics, they have counseling services. I try to find out who specifically they hire, what kind of licenses they require, and that kind of thing. I couldn't find that information on the website. I did contact them, and I have not heard back yet. But I thought it was a really awesome place that has very, very good reviews as well. And then finally, a quick summary. So, intimate partner violence is a complex issue with grave consequences. To better understand our client's circumstances, we must learn about the theories, factors, and stressors behind IPV. I hope we were able to learn a little bit about them today. When talking to a victim of IPV, there are several considerations we must make to ensure that they feel validated and understood. And I think that's one of our most important jobs as crisis workers, as future crisis workers. So I hope you guys all enjoyed this. These are, of course, my references as well. And yes, that is basically our presentation. Let me just move back to the front here. Yes, I hope this presentation was helpful. If you have any more questions, please let me know. I'm really, really grateful for this class. It's opened my eyes to so many crisis issues, and I hope to maybe explore the idea of being a crisis worker one day. So thank you so much, and have a wonderful day.